Good afternoon, everyone. My paper presentation is about a study of Barrett's universal 2 versus SRKT formula to calculate IOL power using immersion ultrasound biometry. Introduction: cataract surgery is considered a refractive procedure, so estimating the IOL power accurately is crucial for cataract surgery refractive outcome. One of the commonly used formula, SRKT formula, that was introduced in 1990 is formulated as a combination of both regression and theoretical approach and has been found to be accurate, particularly in the eyes with axial length more than 27 mm. The Barrett Universal 2 formula, an updated version of BU formula, was introduced in 2010 by Graham D. Barrett and has shown promising results so far. My aim is to compare the predictive accuracy of refractive outcomes after cataract surgery using SRKT and BU2 formula. Objective is to assess the refractive outcome after cataract surgery using SRKT formula and using BU2 formula, and to compare the refractive outcomes after cataract surgery between SRKT and BU2 formula. My study type is cross-sectional analytical study, including 60 patients, 30 patients in each group, and patients were randomized into 2 groups using random tables, and study period is October 2022 to July 2023. Informed consent was taken and done in a tertiary hospital. Inclusion criteria is patient above the age of 50 years, existence of age-related immature cataract based on LOC3 staging, and no history of previous surgeries. And exclusion criteria is patients excluded with retinal or corneal pathology, traumatic cataract, congenital cataract, glaucoma, squint, corneal degenerations, high corneal astigmatism, that is more than 2.5 diopters per cathometry. Patient demographic details have been recorded, and patients were grouped into Group S and Group B and undergone complete ocular examination, including BCVA, IOP measurement, slit lamp examination, fundoscopy, and biometry were done using IOL power calculation by A-scan ultrasound biometry by immersion method and AIOCMT3. All patients have undergone standard phacoemulsification procedure with 2.8 mm incision and implantation of foldable IOL is done. All surgeries were performed by a single surgeon. Only uneventful surgeries have been included. BCVA is measured at post-operatively at 6 weeks. Refractive error predicted was obtained was tabulated. Comparison of outcomes in both groups was recorded. The collected data was entered, analyzed using Microsoft Excel 2019. The independent sample t-test was used to compare the mean in 2 groups, and Bland-Altman plot was constructed to see the agreement between 2 formula of IOL power calculation. There is no significant difference in the predicted error between SRKT and Barrett Universal 2 group, and there is a significant difference in the obtained error in between the 2 groups. And there is significant difference in between predicted and obtained error in both SRKT and Barrett Universal 2 groups. The Bland-Altman plot was constructed, and there is a positive agreement between the 2 formulas. In the present study, with 60 patients, the conclusion is the Barrett Universal formula provides a better predictivity of IOL power calculation than SRKT formula, whereas in Demian et al., including 34 patients, the study concluded that Barrett Universal 2 formula outperforms both the SRKT and Hedges formula for highly myopic eyes, whereas in Kutimilal et al., 244 patients included, Barrett Universal 2 formula performed the most accurate formula in the prediction of post-operative refraction over a wide range of axial lengths. Conclusion: the Barrett Universal 2 formula provides a better predictivity of IOL power calculation than the SRKT formula, and clinically helpful for improving the refractive accuracy post-cataract surgery. My limitations of the study is, although immersion ultrasound biometry was used in the study, optical biometry is often preferred for assessing ocular parameters in order to determine IOL power using the BU2 formula. Thank you.